And we danced on Mix 94.5. It's The Bunch with Freddie, Lisa and Catapult. Good morning. I jest, but we've got a serious gentleman in to talk with us today on Ask an Expert, Dr. Glenn Murray, who's the Medical Director of Absolute Cosmetic. Glenn, thanks for coming in today. Great to have you on.
Thanks for having me, Fred.
Now, you've had over 15 years of experience, completed over 10,000 procedures. You are an international lecturer, named one of the top 10 cosmetic injectors by QMED worldwide. And, of course, Absolute Cosmetic are an advertiser on Mix 94.5. But thanks for being our expert today. Now, a question that often comes up, are you morally, and it's been asked by T on our Facebook page, is a cosmetic surgeon morally obligated to tell a patient when they've had enough plastic surgery or don't need it at all?
I think it's more than moral. It's morally and professionally obliged. We were just looking at some photographs just before we came on air.
Yes, Elsa Pageant. Ladies who watch The Real Housewives of Miami, we know who Elsa is, don't we? She looks like she's been in a fire.
Yeah, oh, it looks worse than that.
It does, really.
But, yeah, it's sad. But I think, absolutely, I mean, we're trained to recognise body dysmorphic disorder and other personality and psychiatric disorders. And I think if we're trained to recognise these people, we've got to do something about it. But like I mentioned before we came on air, so I also think that they're not good for our business either. Yes.
No.
For people to say, is that what happens if you have anything done? And a lot of people do come into me and say, can I have a little bit done or do I have to have a lot done? And I think when you look at the photographs like that, people will think that you've got to have a lot when you don't.
Mm. Is that in itself a little bit of a red flag when they refer to a bit done? I mean, if you don't know specifically what it is that you would like to address, it's not like, you know, just a way to spend an afternoon. It's surgery.
I agree completely. Well, there's non-surgical things as well, and there's a lot of little things that you can do. But no, it can be a red flag. You've got to sort of look at people and listen to them. But really, some people come in and say, listen, I know I want to freshen myself up, and I don't really know what I want to do.
Oh, that's, fair enough. Yeah.
And they're some of the hardest patients, and I usually have a plan A, B, and C, and I say, listen, go away and think about it for a while, have a cooling down period, and then pick where you want to come in. And usually plan A, the simple stuff, is the good way to start.
Yeah.
Is there something that's more common than anything else that people come to you about?
Yeah, well...
Guess it depends on what stage they are
exactly,
at in their life.
Yeah. I mean, you've got younger people and more mature people like us, and not you, but us. So a lot of people just say, listen, I look tired. I noticed around the GFC, a lot of people said to me, listen, I look worried. And people say to me at work, you look worried. And I am, but I don't want to look so worried and so tired and run down because I've got to perform. And that was a very different and interesting thing for me to approach and have to deal with, especially the men that used to come and say, I'm frowning all the time. Everybody thinks I must be going broke. You know, can I look more refreshed so I can perform better? So to me,
weird sort of
that was, it was something different.
So
you need to address something else.
Are the numbers of men coming to you increasing?
Amazing. I think fly in, fly out guys, you know, they go up to the mines, they have all this great food, they get a bit lazy, they get busy, 12-hour days, 6 days a week, they get out of the routine of exercise and they put on some weight and then they start exercising again and say, listen, I can't shift it, what can I do? So, and we talk about liposculpture. Obviously you go through the basics, exercise, diet, etc. And then they say to me, well, I've done that and this bit won't go anymore. So
these guys driving these enormous trucks are popping in for a bit of lipo in their in-between time.
And the nurses will say to you, it is amazing how many guys do come in for it. It is.
Well, stop covering it up with that fluoro.
Exactly.
It's Ask an Expert with a bunch today. Dr. Glenn Murray from Absolute Cosmetic. If you have a question, call us now, 133353. We'll get into it shortly. It's 7:13. Checking traffic with Captain Paul.
Yes, we've just heard from Diane to let us know there's